This video will focus on the specifics of reporting PQRS measures using your electronic health record system. The EHR option is appropriate for practices of any size and can be used if you are reporting measures individually for each provider or if you have chosen to report as a group. CMS is working to reduce the burden of reporting quality measures through various different programs. Their solution is to allow you to report the same quality measures for both the Meaningful Use and the PQRS programs. If you report 9 quality measures from 3 domains, you will both earn the bonus of 0.5% and avoid the penalties in 2016. For this reporting option, your quality measures will reflect services to all qualified patients regardless of payer, and you can report measures that have zeros in either the numerator or denominator as long as at least one Medicare fee-for-service patient is included in the numerator of one measure. First, you must have a 2014 certified EHR system in order to report PQRS through your EHR. You must verify that the EHR calculates and reports the June 2013 version for each of the 9 measures that you report. Generally, this will be listed as V2, but there are a few measures that are V1 or V3. To verify the 2014 certification and the quality measure versions of your software, you can go to the Certified Health IT product list at the web address shown here. Click on the 2014 edition button. Enter the product name and click Search. Then click Ambulatory in the bottom left to further narrow the choices shown. If the resulting list does not include your EHR, this may be because it is not yet certified to the 2014 standards, or it could be listed under a different name. You can also search by vendor or by the actual certification ID number, which could be provided to you by your vendor. You'll likely get a list like this with many different entries. In general, you'll want to look at the lines that say Complete EHR, and you may need to review the Additional Software Required column in order to identify which row relates to your product. Click on the name of the product to see the detailed certification data. Scroll down until you see the section labeled Ambulatory Clinical Quality Measures. The checkmark indicates which of the 64 measures have been certified for this product, and both the version and the domain are shown. You'll need to report 9 quality measures. In general, they will need to be listed as V2. However, there are a few exceptions shown in the footnote. There are 6 domains, and you must pick measures so that you have at least one measure in each of 3 different domains. Many EHRs will give you little choice, having only 9 to 12 measures available to choose from. You'll want to ensure that you are comfortable with the performance rates that you'll report for these measures. For 2014, you will not be penalized based on the performance rate unless you have more than 100 providers in your group. However, it makes sense to spend time and energy developing workflows and processes to support quality measures that you want to focus on, rather than those that are available but not particularly valuable for your patient population. Some providers and practices will decide to forego the easy approach of EHR reporting, even if it's available to them, because the measures that you report are not applicable to your patient population or don't show you as a quality provider. You'll also need to understand from your vendor exactly what you need to do to report these measures to CMS. There are 2 general approaches, and most EMR vendors will offer only one of these. Under the direct reporting option, someone in your practice will actually download individual patient data from your EHR and then upload it into a CMS website. The vendor should provide you instructions. You will need to have an IAX password from CMS and follow instructions that will be provided on their website. You'll do this during the first 2 months of 2015. Some vendors will submit the data for you, but likely will charge a fee. There's also an effect on your meaningful use attestation process. In 2014, you are required to attest for only a calendar quarter rather than the full calendar year. This is true whether you are reporting for Stage 1 or Stage 2. Normally, you would manually enter the numerators and denominators of each of the 9 clinical quality measures for each provider. If you elect to use the EHR option to report clinical quality measures for both PQRS and meaningful use, you will not enter these data when you attest for all other meaningful use measures. Instead, you will complete the attestation on the regular website and indicate that you will be uploading the quality measures from your EHR. You will not receive your Meaningful Use bonus funds until you have completed this process, usually in January or February of 2015. A word of warning. This is a new process for EMR vendors as well as for CMS. You will need to work closely with the vendor to understand how this will work. Because the data is reported after the end of the calendar year, during January and February of 2015, we recommend that you utilize this approach only if you have a high confidence that your EHR vendor will provide you appropriate assistance and ensure your data is submitted successfully. If you're not 100% confident, you may want to consider a backup plan using one of the other PQRS reporting approaches for 2014. It's important to talk with your vendor about their approach and commitment to joint PQRS meaningful use reporting. If you're considering this option, we encourage you to start early to address the issues listed here. If your vendor participated in the pilot program for 2013, ask them for the names of 1 or 2 practices that were involved and contact them to better understand what challenges they faced and to learn from their experiences.